Comprehensive assessment of behavior domain in CHC assessments. The individual able to follow interventions, or do they exhibit non-concordance with care? Does the individual's level of compliance fluctuate, or are they consistently non-compliant? With interventions, do they refuse care, medication, or essential interventions? And if so, how frequently does this occur? Are there patterns or triggers associated with non-compliance? And have strategies been implemented to manage these behaviors? Do they exhibit challenging behavior? And what is the nature, frequency, and severity of these behaviors? Have they demonstrated physical aggression, verbal aggression, shouting, screaming, or inappropriate behaviors towards staff or others? Do they exhibit behaviors such as throwing objects, spitting, or resisting care? Is there a risk of harm to themselves, others, or property due to their behavior? Does their behavior require intervention from skilled or specialist staff? And what level of intervention is necessary? Are their behaviors predictable, or do they occur unexpectedly without warning? Are there identifiable triggers that contribute to episodes of challenging behavior? Are behavioral episodes mild, moderate, or severe? And how does the intensity impact daily care? Have staff implemented de-escalation techniques? And how effective are these in managing behavioral distress? Does the individual respond to reassurance, redirection, or distraction when they become agitated? Does the individual engage in socially inappropriate behaviors, such as undressing in public, making inappropriate comments, or acting impulsively? Do they exhibit sexually disinhibited behavior? And if so, what are the nature and impact of these behaviors? Has sexually inappropriate behavior caused distress or risk to themselves or others? And how is it managed? Are there behavioral concerns related to paranoia, suspicion, or mistrust of carers and family members? Has the individual exhibited hoarding tendencies, obsessive behaviors, or ritualistic actions that interfere with their care? Does the individual experience hallucinations, delusions, or psychotic symptoms that impact their ability to engage in care and daily activities? Do they require medication to manage challenging behaviors? And if so, what medication is prescribed, and at what dosage? Is medication used as a regular treatment or on an as-needed (PRN) basis to address specific episodes of agitation or distress? Have alternative non-pharmacological interventions been explored? And how effective are these in managing behavior? Are medication side effects contributing to behavioral concerns or impairing the individual's quality of life? Does the individual experience excessive drowsiness, agitation, or confusion due to prescribed medications? Has the individual received specialist mental health intervention in the past 6 months? And what were the outcomes? Have assessments been conducted by professionals such as psychologists, psychiatrists, behavioral therapists, or community mental health teams? Do they require continuous monitoring due to the severity or unpredictability of their behavior? Has the individual's behavior led to any safeguarding concerns or interventions? Has their behavior resulted in incidents of self-harm? And if so, what measures have been taken to reduce risk? Has their behavior led to incidents involving harm to others? And what interventions are in place to ensure safety? Do they require constant supervision, or is intermittent monitoring sufficient? Have structured routines and familiar settings been beneficial in reducing behavioral distress? Are specific staff members or carers more effective at managing behavior due to established relationships and trust? Does the individual require additional time, space, or specific environments to minimize distress and agitation? Do they require environmental modifications such as reduced noise levels, private spaces, or specific seating arrangements? Has their behavior been assessed using formal tools such as ABC charts? Have risk assessments been conducted to evaluate the likelihood and severity of challenging behaviors? Has a behavior management plan been developed? And how effective has it been in reducing incidents? Has the intensity and frequency of behavioral incidents changed over time? And what factors have influenced this? Have sleep patterns been assessed to determine whether disrupted sleep contributes to behavioral issues? Does the individual experience restlessness, insomnia, or frequent waking? And does this impact their behavior? Have adjustments been made To their routine, environment, or medication to improve sleep quality? Has their behavior impacted their ability to engage in social or recreational activities? Have interventions been adjusted based on the effectiveness of previous strategies and what ongoing support is needed? Have staff or carers required additional training to manage behaviors effectively? Have multidisciplinary teams such as behavioral specialists, psychiatrists, or social workers been involved in care planning? Have all behavioral concerns been documented accurately in daily logs, incident reports, or behavioral assessments? Does the individual require ongoing assessment and review to ensure that behavioral management strategies remain effective? Has there been a recent decline or escalation in behavioral challenges? And if so, what factors have contributed to these changes? Does the individual require continued input from mental health professionals to reassess behavioral concerns and develop additional strategies? Please share your thoughts in the comment section below.